Imagine a disease affecting millions worldwide, but many have no idea they have it. This silent epidemic is fatty liver disease. Fatty liver disease, in its simplest terms, is the accumulation of excess fat in your liver. Picture this: your liver, the largest internal organ, works tirelessly to filter and detoxify your blood, produce proteins for blood clotting, and generate vital chemicals that help digest food. Now imagine this crucial organ gradually being infiltrated by fat cells, compromising its ability to function optimally. In the vast expanse of our global population, millions are living with this condition, often unbeknownst to them. You see, fatty liver disease is a master of disguise, often lying dormant without any signs or symptoms in its early stages. It's like a stealthy intruder, quietly causing damage, often going undetected until it has advanced to a more serious stage. This makes fatty liver disease a silent epidemic, silently spreading, silently affecting, and silently causing potential harm. It's a ticking time bomb in the health of many individuals, with the clock hands moving, unbeknownst to them. What's more alarming is that it's not a rare condition reserved for a select few. It's a widespread health issue, prevalent across continents, cultures, and age groups. This is not a disease that discriminates. It's an inclusive menace that can affect anyone, anywhere, at any time. But why is it that so many people are living with this condition without even realizing it? The answer lies in its silent nature. The early stages of fatty liver disease often present no symptoms, making it easy to overlook. It's like a chameleon, blending into the backdrop of our bodies, often only revealing its true colors when it has progressed significantly. Fatty liver disease is a ticking time bomb, but what causes it? This question is the stepping stone to understanding this silent epidemic. In our next segment, we'll delve into the causes of fatty liver disease, shedding light on this shadowy condition. Stay tuned. The causes of fatty liver range from lifestyle factors to underlying health conditions. The primary cause is obesity, a condition affecting millions worldwide. When your body takes in more calories than it can burn, the excess is stored as fat. Some of this fat can accumulate in your liver, leading to fatty liver disease. Closely linked to obesity is diabetes, specifically type 2, which affects the way your body uses insulin. When insulin isn't properly utilized, fat can build up in the liver, exacerbating the condition. High cholesterol is another key factor. When you have high levels of fats, also known as lipids, circulating in your blood, it can lead to fatty deposits in your liver. It's a vicious cycle, really. Fatty liver can increase your cholesterol levels, and high cholesterol can contribute to fatty liver disease. Then there's alcohol. We're all familiar with the term beer belly, but it's not just your waistline that suffers from excessive alcohol consumption. Alcohol can damage or destroy liver cells, and the resultant inflammation can lead to a buildup of fat in the organ. But lifestyle factors aren't the only causes. Certain medications, including some used for cancer and HIV, can contribute to fatty liver. Even rapid weight loss can be a factor. You might think losing weight quickly is a good thing, but it can actually cause the liver to go into overdrive, processing fat too fast, and leading to fatty liver disease. In summary, the causes of fatty liver disease are multifaceted, encompassing lifestyle choices, underlying health conditions, and even certain medications. But the good news is, many of these factors are within our control. By understanding the root causes, we can take steps towards prevention. Now that we know the causes, how can we spot the signs of this silent disease? The symptoms of fatty liver disease can be as subtle as a butterfly's flutter, but as we know, the flutter of a butterfly can cause a tornado. Fatty liver disease is often a silent condition, with many individuals unaware they have it until it's advanced. This underscores the importance of understanding the signs and symptoms, as well as regular checkups for early detection. One of the most common symptoms of fatty liver disease is fatigue. This isn't just feeling a little tired after a long day, it's a persistent exhaustion that doesn't improve with rest. It's the kind of tiredness that makes it difficult to focus, to complete daily tasks, and that can greatly affect your quality of life. Along with fatigue, many people with fatty liver disease experience a sense of discomfort or pain in the right upper part of their abdomen. This is where your liver is located. It's not usually a sharp pain, but more of a constant dull ache that can be easy to dismiss or attribute to something else. Unexplained weight loss is another sign of fatty liver disease. While losing a few pounds without trying might seem like a cause for celebration, it can also be a sign that your liver isn't functioning properly. If you're shedding weight without a change in your diet or exercise routine, it's worth discussing with your doctor. Other signs to look out for include a yellowish color to the skin and eyes, known as jaundice, and swelling in the abdomen and legs. If you notice any of these symptoms, it's important to seek medical advice. Let's not forget that symptoms can vary greatly from person to person, and many people with fatty liver disease may not have any symptoms at all. That's why regular medical checkups are so crucial. They can help detect the disease in its early stages before it progresses to a more serious condition. Remember, the earlier fatty liver disease is detected, the better the chances for successful treatment. If you suspect you may have fatty liver disease, how can you be sure? Let's talk about diagnosis. Diagnosing fatty liver disease requires more than a simple blood test. In fact, the process involves a combination of various diagnostic tools that provide a more comprehensive view of what's going on inside the body. A common first step is an imaging test. This might be an ultrasound, which uses sound waves to create a picture of the liver, revealing any abnormal fat accumulation. Ultrasound is non-invasive and painless, making it a preferred choice for initial screening. However, while ultrasound can detect fat in the liver, it may not always accurately determine the severity of the condition. In such cases, a CT scan or MRI may be employed. These imaging tests provide more detailed pictures, helping doctors to better evaluate the extent of liver damage. Next, let's talk about liver function tests. These are blood tests that measure specific enzymes and proteins in your blood. Levels outside the normal range might suggest a liver problem. Elevated liver enzymes, for instance, can signal inflammation or damage to cells in the liver, but even these tests don't give the full picture. For a definitive diagnosis, a liver biopsy might be necessary. This procedure involves inserting a thin needle through the skin and into the liver to collect a small tissue sample. The sample is then examined under a microscope to check for signs of damage or disease. While it's more invasive and carries some risks, a biopsy is the most accurate way to diagnose fatty liver disease and assess the stage of liver damage. It's important to note that these tests are not standalone. They are part of a larger diagnostic process that also takes into account your medical history and physical examination. So what happens once fatty liver disease is diagnosed? The journey doesn't end there. In fact, it's only just beginning. The next step is to understand the treatment options available, which can range from lifestyle changes to medication and, in severe cases, surgery. Once diagnosed, what's the next step? Let's delve into treatment options. The treatment for fatty liver disease isn't found in a pill bottle, but in a lifestyle overhaul. Fatty liver disease is not an ailment that can be simply cured with medications or surgeries. Instead, it requires a significant shift in your daily habits and lifestyle. The fight against this condition begins at home, with the choices you make every day. One of the primary strategies for treating fatty liver disease is adopting a healthier diet. This doesn't mean you have to give up all your favorite foods. Instead, it's about making smarter choices. Incorporate more fruits, vegetables, lean proteins, and whole grains into your meals. Minimize the consumption of saturated fats, sugary drinks, and high-sodium foods. Remember, moderation is key. Another crucial component is regular exercise. It's not about becoming a marathon runner overnight. Start with small steps. Maybe it's a brisk walk around the block, or perhaps it's a few minutes of yoga in the morning. The goal is to get your body moving, to help burn excess fat and improve liver function. And let's not forget about alcohol. Excessive intake can exacerbate fatty liver disease. So it's important to moderate or, in some cases, completely eliminate alcohol consumption. In severe cases, when the liver has suffered extensive damage, a liver transplant might be the only option. But remember, this is typically the last resort, and most people with fatty liver disease will never need to consider this path if they take the necessary steps to manage their health. Fatty liver disease is a silent but preventable disease. It starts with awareness, and that's what we aim to spread. If you found this video helpful, remember to give it a thumbs up, share it with your friends, and comment below. Your engagement helps us reach more people and combat this silent epidemic. Remember, knowledge is power.